Hey everyone, and welcome back to my channel, Delicious Vegging. My name is Anna. I have my dog Marshmallow here with me. So if you follow me on Instagram, I know all of a sudden I just posted that he was having surgery, and I just wanted to give you all a health update. There's just been so much going on within like the past 2 or 3 weeks. I went out of town twice. One was for work and was like very unexpected. I had to go for my job, and then Marshmallow's health, just all these things were going on. So I just want to give you all a little update. And if you're new to my channel, welcome. I focus on content such as beauty, lifestyle, and how to save money. So if you're interested, please hit the subscribe button down below. Also, let's give this video a thumbs up. Be sure to turn on notifications. I upload every Wednesday and Saturday, and just go ahead and jump right into it. About 4 to 5 weeks ago, so Marshmallow is blind if you are new here for about 4 years now. So one eye is smaller than the other. It's on the other side. His lower eyelid was swelling up so bad. It was super red. He was just not acting like himself. So I took him to his primary vet, and at first they thought it had something to do with like a tooth infection. And then also they said he had a fever. He was dehydrated, so they gave him liquids, and then also they treated him with antibiotics and ran some blood work. And then the next day, or actually it was about 2 or 3 days later, because like over a weekend, they called back and said, hey, I would rush him to emergency somewhere where they have like more specialty, like internal medicine, like where he normally goes to, because his red and white blood cell count was pretty low, and they were saying if he does have some sort of infection, like his body can't find it. So I rushed him to emergency, and then all of a sudden they told me like I need to stay in my car because they thought he had parvo. And then they took him back and they didn't even test him for parvo, but they were acting like he had it. And then I asked, like, you know, if there was like such a huge concern, like why didn't they test him? She's like, oh, once we had him back there, he didn't really like have these symptoms, but we still want to be cautious, which I thought was kind of weird because the receptionist was like, oh my goodness, I hear so much about Marshmallow because he's been there quite a few times, unfortunately. And she's like, can I like pet him and say hello? I was like, oh yeah, of course. She's like, oh, I hear how sweet he is and like how good he is. And then all of a sudden, like a medical assistant runs out in front of the waiting room in front of everyone and goes, you might want to put on gloves if you're going to touch him. And I'm thinking, well, you charged me for the parvo test. They did refund me, but I'm thinking, I understand like safety for like other pets and like humans, but if you really thought it was like a huge concern, like why didn't you test him, you know? And it ended up being negative though. And then also they thought he had some type of like parasite, which that came back negative. And they ran more blood work, and they said that blood work came out fine. And I said he literally had blood work like 2 days ago, and she said it could differ like every single day, but now is like in the normal range. So just to like see how he's like acting to the antibiotics. And so once he finishes antibiotics, they said to get like another blood work. So I was like, oh my goodness. He had about 3 blood work tests in about like a week span, a week and a half. So it was draining my bank account, like having to like coordinate like when to take him, you know, not leaving like work too much because it was just pure chaos, because I just want him to be as healthy as can be. So then he had blood work again, and they said like, okay, like the red blood cell was still a little bit low. I think the range is like 35 is like the normal range, and he was like 33 point something, whereas before it was like in the 20s. So they're like, you know, still a bit low, but not as concerning. And his white blood cell count was normal. So they're just like, you know, just see how he's acting. But right now there's nothing to be concerned about. So I was like, okay, cool. So the past 2 blood works came back fine, and he was like acting a bit better. However, his eye was a little bit swollen. And this is a week that I was leaving to Dallas. I mean, I was only there for the weekend, so it wasn't gonna be a long trip, but I just hated seeing him like that. And I know Ernie was gonna be here all day during the weekend to take care of him. Like I wrote down like the emergency numbers, like here's his health records in case you do need to take him. And I just couldn't leave like peacefully knowing that his eye was like that. And it was just like so hard for me, because everywhere that I called, they're like, oh, we can't see him until like August or September. And this was like late July, early August. So I was literally calling like any place possible, like trying to get him in. I was even going to go to like my neighboring states or whatever, because I was like, I don't want him sitting with something like for 2 to 3 months and it's getting worse, or, you know, I'm just like thinking worst case scenario. So finally I called the place that he's been to quite a few times. Normally they want to check his eyes once a year. And once she saw like his records, because at first she's like, you know, I can bring him in on emergency, but it's not guaranteed that I was going to see ophthalmology, because at this point I'm like, I think he needs to see ophthalmology because it has to do with his eye. She's like, you know what, you've been here a few times, I see the notes, you know, Marsh has like a lot going on, like he's seen like internal medicine there, ophthalmology. So she connects me with ophthalmology, and I actually had an upcoming appointment just to get his eyes rechecked in like late August. And it was actually the doctor that was going to see him, and I was telling her everything. She goes, you know what? I don't think it has to do with his eyes, to be honest. Like, you can still bring him in, but I feel like it's in like connection to something else just based on these symptoms. But if he can get here by 4, like, I'll come and see you. And it was like a 40-minute drive. It is literally the day before I left for Dallas. So I told work like, hey, I'll make up the time. I need to take my dog to emergency. So luckily I was able to take him in, and she goes, actually his eyes look pretty good. And I'm thinking, well, what's causing like that swelling? Because it was like his lower lid area is just like super bulgy, super red. And she goes, I think it's in relation like to his teeth. She's like, do you mind if I run him over to dental? Because at this place they have like internal medicine, like dental, dermatology, they have it all there. So I was like, oh yeah, for sure. So she ran him over to dental, and then she goes, so the swelling is like due to his teeth being fractured on both sides, so he will need dental surgery. Unfortunately, we are booked out for months, so I would recommend calling like these places. And just to let you know, I'm pretty sure they're pretty booked out too, so it may be like a month or 2 before he even gets seen, and then from there they could schedule the surgery. And I told her like, oh, you know, I'm leaving out of town this weekend. She's like, when will you be back? I was like, oh, Sunday, because it was like Friday or Thursday. And then she's like, oh, well, you're just going for a day. And I'm like, I don't know if I should leave with him like this. And she made me feel so much better because we've been there like plenty of times, and she sees how many times Marshmallow's been there. She goes, look, you're doing the best that you can. Nothing's gonna change in one day where he can be seen. Like I said, you're waiting for like a month or 2. So I'm gonna give him some pain medication. Your husband's gonna be home all day. Like, just go on your trip. You'll be fine. He'll be fine. And I was like, okay. And she's like, you know, his eyes are actually pretty good despite the swelling. It's due to his teeth. He's in a little bit of pain, but I'm gonna give him some pain medication, and someone's gonna be home with him. Like, so go, just, you know, try and enjoy yourself for that day, which I thought was like super sweet of her. And she did me a solid. She goes, you know what? I know this was on an emergency basis, but I'm just gonna charge you for a regular visit and just for the medication. So I was like, oh my goodness, like thank you so much, because these fees are racking up. But you know, I don't have any children. Marshmallow is my fur baby. I thought that was so kind and so sweet of her. And then afterwards he was like perking up, like the medicine seemed to help. And then I went to Dallas and I came back, and then on Monday I was just calling every single place possible. Like the place she originally referred me to, they couldn't see me until September just for an exam, and then she said from there it takes 2 to 4 weeks. And so I'm calling like all these places. I even called his original vet from when he was a puppy, and they were like, can you come in today at 2 p.m? And I was like, yeah, for sure. So I told work again, like, hey, I need to go, like my dog needs like surgery. I found someone who like take him in, and luckily they were like very understanding. So I take him in, and they were like examining him. They really like took their time with him. I had to bring in like all his medication, and then they go, so we can do surgery tomorrow. And I literally laughed. I was like, oh yeah, when can you really do it? And he's like, no, seriously, I can do it tomorrow. And I was like, are you serious? Because everywhere else was telling me like November, October. You know, the earliest I got was like mid-September, and that was just to see him, not even for the surgery itself. So I was like, okay, yeah, I'll do it. And I was like, oh, because work told me I had to go to Irvine for a week for a training class. So I was like, I don't know. And he goes, honestly, I would like do it now, because if you wait 2 weeks, it may get worse. And then he told me like, when are you leaving? He goes, okay, the first 3 days are rough, and you're gonna be there for like 5 or 6 days before you leave. Like, I say do it tomorrow. So I was like, okay, like let's do it. So Marsh had surgery, and they did blood work. His liver and kidney levels were good. And oh my goodness, when I picked him up, he had so much energy. Like, we went to my parents' house. He was like hopping around in the backyard, wagging his tail. And then he tried eating his dry kibble, which he was supposed to eat like his canned wet food. And I was like, no, Marsh. I'm like, oh my God, he's acting fine. First 2 days, he had so much energy. You would not think he had surgery. But then after that, he started acting very like lethargic. He would not eat because I had wet food for him, which he normally loves. He wasn't drinking water. So the day before I left for my work trip, I was like, you know what? Again, I can't leave with him acting like this. I need to make sure he's okay before I go. So I take him in, and they were concerned because he wasn't drinking water. It was like past like the 3-day mark. He should have been getting better. So it's like the 5th or 6th day now. And they're like, okay, that's very unusual. and I got to see a different doctor. Oh my goodness, she was so rude and like so not sympathetic at all. So she comes out at first, like she was fine. She's like, oh, you know, I'm Dr. So-and-so, like nice to meet you. And she's like, he has yellowing in his ears, like his skin looks yellow. I think he has liver disease. And I was like, wait, what? And I was like, he literally had blood work like 4 or 5 days ago. I was like, and his liver and kidney levels came back fine, because that was a cause of concern for him to even have the surgery. So they wanted to run a day of to make sure he was good. And then all she said was, things changed, sorry, like just like that. And I was just like, oh. And then she's like, I need to do blood work again. I think he has kidney disease or liver disease. Like just very like stern, and you could tell like she wasn't sympathetic at all. And I was like, okay, yeah, like let's do it. And I was just like, whoa. And I started like Googling in the waiting room, and I started crying because, you know, there's like a life expectancy. And I just saw her delivery was like super rude, because his prior doctor and the other medical assistant was like super nice. And I understand if that was like a cause of concern. She could have said something like, you know, I see a little bit of yellowing in the skin. Typically that leads me to think he may have liver disease, just to confirm or to see what it could possibly be. Do you mind if I proceed with blood work? That would have been fine, but just to say, you know what, I think he has liver disease, like thanks. And then I was like, wait, well, he had blood work 4 days ago. She's like, things changed, sorry. And like did that. I was just like, okay. So I'm over here crying in the waiting room because, you know, it's Marshmallow. And then she like takes me in like her office because there wasn't a room available. And then she takes me in the room, and she would not make eye contact with me. She was like looking at me with disgust. They were able to run the blood work in-house. And then she proceeds to say, okay, so I got the results back. He doesn't have liver disease. Sorry I said that. I wasn't the doctor who saw him on Tuesday. And I'm thinking, okay, like that's your apology. And she goes, so I heard you guys are going on a trip. So who's taking care of Marshmallow? I'm thinking, excuse me, you know, like I did tell the medical assistant I was going on a work trip, and then I go, it's just me, it's for a work trip, I'm not going for fun, otherwise I would have canceled it. I'm literally leaving tomorrow. She's like, well, who's taking care of Marshmallow? And then Ernie's like, I am. She's like, are you gonna be with him? I'm just like, dude, like what is your problem? Like she was just like so rude, or she already made me like feel bad. Like she didn't even know, like the medical assistant, like when I brought Marshmallow in, I brought in his whole folder. He's like, oh my goodness, he's been to so many places in such a short amount of time. He's like, he's had like 3 or 4 blood works like within the past 2 weeks. So I'm thinking, don't make it look like I'm neglecting my dog. Like he is very well taken care of. I'm coming like the day before I leave because I'm not at peace with leaving him, even though he's gonna be with Ernie. Ernie's gonna be at home with him, and like my parents are gonna be here to help out as well. Like he's well taken care of, and I already feel guilty as it is. And it's for work. It's not like I just like planned to go like Miami or something, or Vegas. Like I'm going to work. And I was actually thinking of just saying like, you know, there's just too much going on right now, I need to cancel. But like I said, it was like Saturday, I was leaving on Sunday. So it just like really irked me, because every other staff member there was like so polite, so courteous. And the medical assistant I saw on Tuesday comes out and he kneels down. He goes, hey, we're gonna waive the blood work because that was more so for the doctor. I know you've been through a lot through the past few weeks, so we just want to rule it out. So don't worry about that. We're not gonna charge you an exam fee. We're only gonna charge you like for the medication. So I forgot to mention, Marshmallow's having a bad reaction to the anti-inflammatory medication, and she kept like going back and forth because he has to take so much medication, and they sent him home with some new ones. And even Ernie was like, wait, you said like stop giving him this, or only give him half a dose, or you know, take it, not take it. So I asked her, I go, oh, do you mind writing it down, because like he's already has to take like so much, and now we're involving like new medication and like changing the dosage and stopping some. I just want to make sure I got it right. And then she looks at me, she goes, normally I don't do that for my patients, but I guess I'll make an exception. I'm just like, oh my gosh, she acted like I was acting like for like the most. So I just did not like her at all. And like I said, medical assistant, his other doctor, they are very good at what they do. They're very sympathetic. They take their time with Marshmallow. Not a fan of her, everyone I saw. So anywho, so everything came back well. It's just like the medication, and Ernie was gonna be home with them and like my parents. So then I felt better about leaving. And while I was in Irvine, I was FaceTiming Ernie every night and having him like show Marshmallow to me. And Marshmallow was doing just fine. Like his appetite came back, like his eye looked better, like the swelling decreased. I was like, how come when I leave, like now he's doing like so much better? And everyone's like, it's because you baby him and like rush him every chance that you get. Maybe he just needs a rest. I'm like, okay, like, you know, that could be true as well, because I just want him to be here as long as possible. Like I just want him to be healthy. That's all that I want. I hate it when he suffers, because when Marshmallow's in pain, he does like a good job at like hiding it, but like I know. Anywho, he was in great hands with Ernie. He was doing so much better, so I was very glad to see that. And then when I came back, I took him to a follow-up appointment. So that was like a few days ago, like maybe 2 or 3 days ago. And they said he still has some swelling on the left side, like where his smaller eye is. But other than that, everything looks good. He's starting to eat his dry kibble now. So they're saying they want to see him again next week just to see if the swelling stopped. They gave him some more antibiotics to see if that'll help. They said if not, to keep my appointment with the specialist to see if there's something else that they can't like service. So we shall see how that goes. I mean, he's still a little like lethargic, but he's eating, he's going outside, he's drinking water. Sometimes he'll play with this busy toy, but you know, I just want to make sure he's okay. But that is the update for now. That's just a little bit of the chaos that I came back to, because when I went to Dallas and came back that following weekend, I had to leave again. So it's just like a lot of like turnaround, like unpacking, packing, taking him to the doctor, just making sure he's okay. And then just like some family stuff and just like personal relationships, like not with Ernie, but just, you know, like family, friends. It's just like, oh my goodness, the past 2-3 weeks. And I'm sorry, but like my little family here is priority. So I'm glad he's doing so much better. And thank you for everyone for wishing him well and like following up, asking how his surgery was. So that is the update for now. Once I have some more information, I'll do like a little life update coming up. I thought I would have like a full Marshmallow update, but that is to be continued. So if you haven't already, please hit the subscribe button down below. Also, let's give this video a thumbs up. Be sure to turn on notifications. I upload every Wednesday, Saturday, and I'll see you all in my upcoming videos. Bye, everyone.